Emanuel, which country has the world's best healthcare? In the book, Which Country Has the World's Best Healthcare, Emanuel takes readers on an enlightening journey through the healthcare systems of various countries, comparing and assessing their effectiveness. The author explores multiple facets such as cost, quality, and availability of healthcare services, to evaluate each country's system. This detailed investigation showcases the unique strengths and weaknesses of the healthcare systems in the United States, Canada, the United Kingdom, Norway, France, Germany, the Netherlands, Switzerland, and China. By integrating data, analytics, and narrative descriptions, this book will not only provide readers with an overview of various healthcare services around the world, but also unveil the key elements for a more efficient and accessible healthcare system.
The Best Healthcare System. In the book, The Best Healthcare System, Professor EzekielJEmanuel analyzes and compares the healthcare systems of different countries. He uses data analytics and real-life examples to refute the promise of the book's title and instead, gives a clear-eyed assessment of each country's approach. Emanuel reveals that Germany and the Netherlands have excelled in healthcare delivery, while the US and China lag behind due to their system's unevenness, for-profit motives, and expenses. The book concludes that no country has the best healthcare system, but there are stellar practices that others can learn from. Healthcare in the US. The US spends the most on healthcare globally, but the system underperforms in coverage, quality, and cost. The country has fewer doctors, nurses, and hospital beds compared to other developed nations. Despite spending nearly twice as much per person on healthcare as other OECD nations, Americans do not receive good value. Canada's healthcare in numbers. Discover the metrics behind Canada's healthcare system. Perception is everything, and for conservative Americans, Canada's healthcare system is socialist, inefficient, and plagued with long wait times. However, applying consistent metrics, EzekielJEmanuel dives into the numbers behind Canada's healthcare system in his book. Emanuel reveals that Canada spends 11.3% of its GDP on healthcare, with 2.7 hospital beds and 2.4 physicians per 1,000 people. His findings show that the Canadian system is not only efficient but also adheres to the needs of its citizens. Through measurable data, Emanuel makes a compelling case for Canada's healthcare system and its ongoing success. The NHS, a mixed blessing. The National Health Service, NHS, in the UK has provided universal healthcare to the British for over 70 years, a feat that deserves admiration. However, the NHS spends 9.6% of GDP on healthcare, lower than the EU average, and has fewer doctors and hospital beds per 1,000 people. In addition, the UK falls short of several countries in Europe, including the US, in the number of nurses per 1,000 people. Despite its achievements, the NHS still has room for improvement. Norway's innovative healthcare system. Norway's healthcare system, funded through taxes, covers a range of needs including health, pension, unemployment, and disability with no access barrier. Despite spending almost twice as much as the UK, only 10.4% of Norway's GDP is used. However, physicians lack incentives to save money or improve quality care. Healthcare in France. France's healthcare system allows patients to choose any doctor or hospital, and access specialists without a referral. The country spends 11.5% of its GDP on healthcare, and has 6.3 hospital beds, 3.3 doctors, and 9.9 nurses per 1,000 people. However, the system is criticized for being paternalistic towards doctors and lacking respect for nurses according to Emanuel's observations. Germany's healthcare system. Germany's healthcare system provides universal coverage with an excess of hospitals available. Spending only 11.5% of its GDP on healthcare, they possess 8.2 beds, 4.5 physicians, and 13 nurses per 1,000 residents. Despite this, their healthcare professionals earn a lower salary than those in the US. Dutch healthcare, a case study. Dr. Emanuel, an expert in healthcare management, examines how the Dutch healthcare system operates. He reveals that Dutch doctors are hesitant to intervene and prefer to send patients home until their conditions worsen. According to Emanuel, the Dutch spend approximately $84 billion per year on healthcare for a population of 17 million, which amounts to almost $5,000 per person. This book serves as a case study, demonstrating the macro and micro factors that affect healthcare in the Netherlands. The risk of Swiss healthcare collapse. Switzerland has a complex and costly healthcare system that could potentially collapse with the looming mass rejection of high premiums. Despite reportedly having one of the highest expenditures on healthcare, Switzerland has a low number of hospital beds and medical professionals per population. Emanuel's findings highlight the need for reform in the Swiss healthcare system to ensure accessibility and affordability for all. China's healthcare system. In Emanuel, China's healthcare system is revealed to be spending only 6.2% of its GDP on healthcare, which is less than $1,000 per person for its massive population of 1.4 billion. The country has a limited number of hospital beds, doctors, and nurses per 1,000 people, prompting concerns on its ability to deliver proper healthcare services. Corruption and infrastructural issues are also contributing factors to the challenges faced by the system. Healthcare in other nations. This book is ideal for healthcare professionals, policymakers, and investors alike. EzekielJEmanuel provides an eye-opening and thought-provoking comparison of healthcare systems in various countries. He proves that affordable healthcare is possible without sacrificing quality, refuting the notion that profit and healthcare can coexist. Emanuel's insightful and actionable solutions are useful for anyone seeking to transform America's healthcare system. If you are not wealthy, his descriptions of other countries' superior healthcare may leave you feeling envious or contemplating a move abroad.
EzekielJEmanuel concludes his examination of worldwide healthcare systems by recognizing that there is no one-size-fits-all answer to attaining the perfect healthcare model. However, the book offers invaluable insights into the best practices of different countries that can potentially be emulated and adapted to suit each nation's unique needs. The comprehensive overview of diverse healthcare systems will enable readers to understand important factors, such as universal coverage, quality of care, and the relationship between a nation's GDP and its healthcare spending. By identifying the standout features of some of these systems and the challenges faced by others, this book serves as an informative resource, with practical implications for healthcare professionals, policymakers, investors, and the general public, all seeking to improve the global healthcare landscape.